Hi guys, today we're going to talk about what to do if you're trying to get pregnant. So there's a few things that you can do to increase your chances of pregnancy. Every time that you're active for 1 month, your chances of pregnancy are 20% during that month. There's a few things that you can do to increase your chances. First of all, you want to make sure that you see your doctors, that you guys can go over any medical history, and they can recommend if you have a medical condition, any treatment that you might want to undergo before you get pregnant. After you've seen your doctor and you've explained to your GYN that you're trying to get pregnant, they might want to send some tests depending on what your medical history is. The other thing is your partner also has to be healthy, so your partner also should get a checkup and see his doctor. Definitely, you want to make sure that you're not smoking, your partner isn't smoking, because that will decrease your chances of pregnancy, or it could increase your chances of having a pregnancy outside of the uterus, like in the tube, which is what we call an ectopic pregnancy, and that would be very dangerous. You want to make sure you're eating correctly, you have a nice, well-balanced diet, your weight is the best that it can be, you're exercising every day, you're drinking a lot of water, you want to take a prenatal vitamin every day, you might want to take an additional pill of folic acid or DHA depending on what your medical history is, and your doctor can help you decide if you need to do any of those things. And then you want to start charting when your period is. So you want to make sure that you're having your period regularly every month, because if you're not having your period regularly every month, then you might not be ovulating every month. So there's this nice app that I always recommend to my patients. It's called My Days, and basically this is what it looks like. So the icon is like, it's this one in the middle. Looks like a little flower. So it's like a calendar. So basically what you do is you just click on whatever day your period started, and it'll give you options: start period, end period, your intimate, make a note, take a photo, or the day you took a pill, or whatever your temperature was that day. So you want to say maybe that's the date that your period started, so you go start period there. So, and then you can modify it and say how many days your period was, if it was a normal period, if it was very heavy, if it was light, and you can modify it. And then it'll start telling you what days you're likely ovulating. So if you're having a period every month, you're probably ovulating regularly. So you want to be intimate or have sex around your ovulation period. For example, if you're supposed to ovulate on the 22nd of the month, so you want to start having sex 2 days before, so the 20th, the day of your ovulation, and 2 days after. So 5 days around your ovulation, and that'll increase your chances of getting pregnant. If you're not having regular periods, you should get an ovulation kit at the store and start checking to see if you're ovulating. Maybe your period's overall regular, but you're not having a period every 4 weeks exactly, and that's very common. So if you're concerned that you're not ovulating, they sell ovulation kits over the counter, and basically it's like it almost looks like a pregnancy test. It's a little stick that you urinate on, and it'll tell you if you ovulated or not. You should try for 3 to 6 months, and if you don't get pregnant by then, you might want to go see your doctor again to see if you're going to need some fertility treatment. If you're over the age of 35, definitely, if you've been trying for 6 months, you don't want to waste any time. So you should definitely go see a GYN and try to figure out why you're not getting pregnant. And they might want to have your partner do semen analysis. They might want to check a pelvic ultrasound on you to make sure that everything is okay there, and then you would go from there. So a lot of times we can find out what the problem is. Maybe there's a cyst, maybe there's a fibroid, maybe there's something going on. But then also other times we can't really find a good reason, so then there's infertility doctors that can help you achieve a pregnancy. So I hope this helped. Don't forget to subscribe to the channel. If you like the video, like it down below. Leave comments, email me at gynogal@gmail.com. Thanks. And then you fold it again so that it's like a U-shaped. Hold it like this, and in a squatting position again, you insert it into the vagina, so it'll go like this.